in this round of Project Health Design, we wanted to better understand how people captured and understood their health and everyday living and presented that to their clinicians. So we've actually moved far away from the idea of a personal health record to the idea that there's lots of different information flows in people's lives. And they might be stored on their iPhone, they might be stored in their medical record, they might be stored at some website like the Health Vault, where there is information about one's health. And we have 5 projects, and we selected projects that would meet a couple of concerns. We needed to make sure we were reaching people with multiple care concerns, because most people have multiple care concerns. We selected projects that were particularly attentive to the needs of challenging populations. It might be young people, it might be poor people, it might be people in rural areas. So we deliberately set out to find these challenging places. We also set out to find projects that were well integrated in a care delivery system, because at this point in our work, we didn't simply need to know did patients need to take care of themselves. We needed to know if we provided that information, did it also assist in accomplishing the overall health goals? So feedback into the information of the care process. The team is called Chronology, and what they did was they worked with patients and a internal medicine physician, a gastroenterologist, and the nurse practitioners that worked with the patients to create a program unique to each person, where they would use the iPad to capture the elements or the daily observations that were most important to that individual. Now, sometimes this would allow an individual to meet with their doctor and decode a pattern that would show maybe they're developing a food sensitivity or they needed to change with their diet. Sometimes, though, that iPad actually served to keep a record of the amount of time that the individual was able to stay healthy as opposed to have an illness problem. So this service actually became not only a tool to detect illness, but a tool to support wellness.